Today we are going to learn about iNBDE questions. Question 1. Patient, male, 12 years, chief complaint, pain in the left lower back tooth region. During mixed dentition stage, which of the following appliances can be used as a space maintainer for missing primary molars in the mandibular arch? Distal shoe, Nance holding arch, passive lingual arch, removable acrylic functional. Answer: passive lingual arch. Why? Passive lingual arch is an effective space maintainer for mandibular arch, but distal shoe is used only to guide the eruption of permanent first molar. The Nance holding arch makes it appropriate only for the space management in the maxillary arch. A removable acrylic functional appliance has the disadvantage of requiring additional patient cooperation. So, the answer: passive lingual arch. Question 2. Patient, female, 35 years, chief complaint, pain in the left lower back teeth region. In an ideal class 5 cavity, preparation for amalgam in a mandibular premolar, retention form is gained into the mesial and the distal walls, in the mesial and the occlusal line angles, or in the axio-occlusal and axio-gingival line angles at the expense of the axial wall, or in the axio-occlusal and axio-gingival line angles at the expense of the gingival walls. Answer: in the axo-occlusal and axo-gingival lines at the expense of the gingival walls, because the principle of retention form is exposed by G.V. Black applies in this situation. The retention along the axio-occlusal and axio-gingival line angles, rather along the mesio-axial and disto-axial line angles, maximize the retention form. Since the wall divergence is less pronounced, it also allows for the initial insertion or retention of the restorative material that is wedged between occlusal and gingival walls, thus facilitating the manipulation of amalgam. So the answer is in the axo-occlusal and axo-gingival line angles at the expense of the gingival walls. Question 3. Patient, male, 12 years, chief complaint, pain in the lower region, severe pain in the lower jaw. Following a bilateral mandibular fracture in the canine region, the anterior fragment of the mandible is displaced posteriorly by the action of geniohyoid, and by which of the muscle? Thyrohyoid and mylohyoid muscles, genioglossus and mylohyoid, thyrohyoid, mylohyoid, and anterior belly of digastric. Genioglossus and anterior belly of digastric. Mandibular canine regions, in the anterior canine region. So, the muscles attached to the anterior mandibular is geniohyoid, genioglossus, and the anterior bellies of digastric. So answer is genioglossus, anterior and anterior belly of digastric. The muscle attachment to the anterior mandibular are genioglossus, geniohyoid, right and the left anterior belly of digastric muscle. Contraction of this muscle will displace the anterior fragment with the fracture through both the canine regions. Question 4. Male 12 years chief complaint spacing in the upper front teeth region. Accepted methods for closing a diastema between the maxillary central incisor include using either a removable appliance with the finger springs or a rubber elastic around two teeth, a steel ligature around two teeth, bonded brackets with intertooth traction. Answer: bonded brackets with intertooth traction. Bonded brackets with intertooth traction provide controlled mechanism for a closing of diastema effectively. A rubber elastic should not be placed around two teeth because this would have a tendency to cause apical migration and severe bone loss areas around the two teeth. It could cause loss of teeth themselves. A steel ligature does not have elasticity to provide an effective orthodontic force. Answer: bonded brackets with intertooth traction. Question 5. Patient male 40 years chief complaint bleeding while brushing his teeth. A depth of the clinical gingival sulcus is the distance from the gingival margin to clinical gingival sulcus is the distance from the gingival margin to cemento-enamel junction. Most apical penetration of the periodontal probe, most apical extension of the junctional epithelium, bottom of the sulcus in the well prescribed histological block session. Answer: most apical penetration of the periodontal probe. The depth of the gingival sulcus is the distance from the gingival margin to the most apical penetration of the periodontal probe. The histological gingival sulcus, that is the distance from the gingival margin to the base of the gingival sulcus in histological sections. It's if the distance, the choice A of 1 has no clinical findings unless the gingival margin is apical to the cemento-enamel junction. The distance between these two is calculated as gingival recession. So, the depth of the clinical gingival sulcus is the distance from the gingival margin to the most apical penetration of the periodontal probe. Thank you.